Hello everyone, I'm Dr. Mary Joseph Mercadel. I am a cardiologist and an electrophysiologist, and as its name implies, I specialize on cardiac diseases and heart rhythm disorders or irregularities of the heart, or what we call cardiac arrhythmias or cardiac dysrhythmias. And today I would like to discuss with you briefly the electrical conduction of the heart, the ECG, and some important common findings that may help you be aware of certain conditions that is probably bothering you. So right now you can see here that there is an analog of the heart, and if you open this, you will see the cross section of the heart, and you see that there are chambers here: the right atrium, the left atrium, the right ventricle, and the left ventricle. You also see some valves: the tricuspid valve, the mitral valve, here the pulmonic valve, and inside here the aortic valve. This is the pulmonary artery, and this is the pulmonary vein. What is important now today is that I would like you to imagine that there is an electrical conduction here that makes the heart contract from the sinus node, which is the natural pacemaker of the heart, and you find that in the right atrium. From the sinus node, which is normally beating at 60 to 100 beats per minute, it depolarizes the atria, then it goes down to the AV node, then the bundle of His, and the right bundle branches, and the left bundle branches, and the Purkinje fibers, thereby making the heart contract. So as you can see, the electrical conduction of the heart is very important, and any abnormality in this particular conduction system can make you have irregularity of heart rhythm, or what we call arrhythmias. For today, I would like to discuss to you some important findings that my patients usually complain to me. And some patients complain of palpitations, shortness of breath, and chest pain. And when we do the ECG, which I would like you to see, this is the ECG machine. And if you take the strip, okay, so first I'd like to let you see this. Okay, as you can see, there are waves in the ECG. This is the P wave here, which denotes atrial depolarization or atrial contraction. The QRS complex, which denotes ventricular depolarization or ventricular contraction, and then the T wave here, which denotes ventricular repolarization or relaxation. I just want you to be familiar with this, and as you can see, the RR interval is regular, and it is at 69 beats per minute, which is normal. So as I mentioned earlier, I'd like to discuss with you some common irregularity or some common problems in the ECG, which may be just variants of the normal. Some patients tell me that they palpitate, and when I check the ECG, they have sinus tachycardia. This is a common finding among patients who are anxious, who just had an exercise, and their heart rate usually is more than 100 beats per minute, but it is still coming from the sinus node. So we call that sinus tachycardia. In these patients, usually we just have to find the cause of the tachycardia, because sinus tachycardia is usually physiologic, or it may have a secondary cause. And it is easily treatable, or it may just be a variant of the normal, or it may just be a finding which is not clinically significant. On the other side of the spectrum, you can also find what we call sinus bradycardia. Sinus bradycardia happens when your heart rate still comes from the sinus node. It is regular, but it beats less than 60 beats per minute. So you call that sinus bradycardia, and usually it happens in athletes. It's also a physiologic finding a normal usually maybe a variant of the normal, and usually it does not require treatment if the patient remains asymptomatic. Okay, so this is my first, I would like to discuss with you these important findings. Later on in my future videos, if you you can comment, you can send me some of your comments if you want to know more about some irregularities in heart rhythm, and I will be happy to let you know and make you a video about it. So please like and subscribe my channel.